the topic also. And at the same time, sometimes we might have to repeat certain portions. With the basics. So here it is, you know this. And we have got the phalanges, right? And in the phalanges, this is what is called as PIP, proximal interphalangeal joint, and this one would be distal interphalangeal joint. Very true that in case of thumb, right? In case of thumb, there is just one, and that is interphalangeal joint. There is nothing like proximal and distal because there are only two phalanges. Carpal bones, right? So here, say scaphoid, lunate. Then this T was what?
Triquetrum.
Triquetrum.
He remembered it like T is tree, right? 3. So then triquetral. And then the PC form. And what about this T and this T?
Trapezium and trapezoid.
Trapezium and trapezoid, right? Because they are like quad and the pyramid shape. Capitate and the hamate. What is this?
Hook of hamate.
Hook of hamate. Very good. Right. Now, we'll be coming across many of the ligaments which will be called as the collateral ligament. Collateral ligament means when on which they just give the support. Say in case of knee, they'll right in case of knee. Tibial collateral ligament and the fibular collateral ligament. So same way, even in case of wrist, collateral ligament of wrist, right? This is on the radial side. Very quickly, there is no need to go into detail of all these various ligaments, but just to know the name. The name is like when it is between radius and ulna, it is called as radio-ulnar ligament. When it is between radius and lunate, so you know that lunate bone, right? So then it is going between radius and lunate, so we call it radiolunate. There is one ligament which is going all the way from the radius to the scaphoid process, radioscaphocapitate ligament, right? Simple as that. So there are, practically speaking, say if you go dive deep now, you'll find that every bone is connected to everyone. Because when we move the wrist into multiple, say angles, right? Multiple axes. So because it is a multi-axial movement, the support is to be given at all levels. So that's why it will be having all examples. One more, this is Palmar radio-ulnar ligament. And in general, when we say that carpal bones, they will be connected to metacarpals, correct? Carpals connected to metacarpals. So in general, we can also call them as carpo-metacarpal ligament. There are more than 30 ligaments over here. No one will ever be asking you questions on those ligaments. So don't worry at all, right? In case if it is asked, then just a simple logic that what is the name it is between carpal and metacarpal. So simply you can speak like that. Its importance will come only when you are going for the reconstructive surgery of hand, which is a super specialty, right? Not surgery, but super specialty. That's one has got the major injury, constructing and tying all the ligaments, everything. So then it becomes a very special thing. Exactly the same way in head and neck when we'll be learning all the facial muscles. But no one will be torturing you for any specific muscle in Viva. But its importance when you are going for the cosmetic surgery, right? If you are doing a cosmetic surgery, so then it makes the difference. That is orbicularis oris, you want to extend it, you want to make it small, right? You want to take stitch become small, but the lips become full. All those. Bollywood, you'll be surprised to know that in Bollywood, almost everyone has gone under the scalpel. सबने सर्जरी कहीं ना कहीं तो करा ही रखी है. By the way, you know about the Ozempic? अभी जो चल रहा है. Yesterday there was a huge party in Mumbai. Ozempic party. That is, everyone is taking that लाख रुपए का इंजेक्शन. Ozempic is that, मतलब गलती से ये डिस्कवर हो गया. बेसिकली तो इट इज फॉर डायबिटीज मेलाइटस टाइप 2. And Ozempic, it is an anti-diabetic drug. It's one-shot injection because it acts GLP receptors, GLP-1. So that its half-life is very long. So almost for 1 week, it keeps on acting. So 1 week तक आपको भूख ही नहीं लगे. So people lose weight like खतरनाक. मतलब who is that Karan Johar, right? He lost some 15-20 kilo. The Ram Kapoor lost some 30-40 kilo. And then they are telling that, yes, this is so good, this is miracle. They don't understand that by this propaganda, people will be more inclined towards this. And say it's cost. मतलब क्या पागल पर $5,000, and if you stop this, so then weight will come back. But the biggest disadvantage is that photographs, right? They, मतलब पूरे चेहरे का चाम ही उड़ गया है, because it eats away those muscles also. So there is no strength left out. Right? It leads to so many other complications. But बस वो weight के चक्कर में now तो even, चलो ज्यादा नहीं बोल रहा. But yes, there is so much of malpractice going on this. So now we start with our, so this much was, let's mute say it. So here is a wrist, right? On wrist, all these, see, this is one simple. If it contracts, right, whatever the structure, right, let's say this is a rubber band. When it contracts, it is stretched, right? But in the process, right, it will bow out. It will bow, right? It will become bow out, bowing. So that's why we need to put something like this so that it doesn't bow out. मतलब बाहर ना आ जाए. Our wrist, right, it is having all these ligaments, but if they contract, then they will, all would come out. But then there has to be something. इसलिए पता है, heavy weight, when you lift heavy in gym, so you should wear those gloves. Gloves is fine so that you don't, your handwriting is not spoiled, and your hands, they remain okay like a doctor. But then there are gloves which are with the wrist support. Always wear that. Otherwise, अगर जो यहाँ से वो pull हो गया muscle, तो then for rest of the day you'll keep. Voice is breaking again. Yeah.
Yes, sir.
Okay, I got message. Got it. Screen will become blur because as soon as the bandwidth will got cut off, just roll over. There might be a momentary delay. Just. Let's see if it improves now. I club the bandwidth from cell phone also. One. Voice is breaking. Now is the voice okay?
Yes, sir. Till now.
Till now. Yes. For all those messages, like unable to hear. Yes, I understand. So here is the wristband. This is like a wristband, right? So that is what is called as the flexor retinaculum. Flexor retinaculum is that fiber. It will be present onto the flexor side. It will be present onto the extensor side, both the sides. So here is flexor retinaculum. It has got the superficial and the deep part. The purpose is to prevent bowing, right? This is the function, to prevent bowing. So let's see it in slightly more detail. Flexor retinaculum is over here. But when it comes to those joints, so even the joints, they are also very properly secured. So these joints, they are having the fibrous sheath. They are called as the fibrous sheath. Fibrous sheath, as if someone has put those sticking plasters, right? So there are two types. One is the circular one, right, which are like tube. And second one is like that crisscross. So thus this crisscross is deep, and on top of it, the tape has been applied. So this outer one, this is a superficial one. This is called as the annular. Annular means circular, right? So you can consider that they are like those tubes. Through these tubes, all the ligaments, right? They will be traveling. Acha. This is the cruciform part. Can you see over here, right? This is cruciform, right? That means this is like a cross. The purpose, it gives strength, right? So this gives strength, and whatever the structures which will be passing through it, they won't come out, right? They will be moving exactly in the same direction. Remember it like that when your finger, but you can move your finger with absolute precision, right? It is not happening that finger goes like this or finger goes like this. No, it moves with absolute precision. This is the reason, because when the finger is to be moved from exactly like this, so those muscles, they will be acting in a very balanced way because they'll be passing through a specific tunnel, right? So these are the fibrous sheath. Today, many of the things will be like, its importance is just to know, right? In exam, they would be asking it. Flexor retinaculum, extensor retinaculum, you should be thorough with it. So here is now the flexor retinaculum, right? And then underneath the flexor retinaculum, see the thing which is highlighted. I'll just zoom this green portion, right? This green portion, this one, right? That green portion, it is called as the common flexor sheath. So flexor retinaculum is above, and नीचे से every muscle, whosoever will be passing, right, and they will be giving their tendons to various locations, but they will be passing through common flexor sheath because we are into flexor component. Okay. So here is lateral and medial part, and two muscles. We know those things, that on the flexor side for the digits, it is the flexor digitorum superficialis, and just underneath there was flexor digitorum profundus. Till this point, we were talking about only these two muscles, कि एक superficial है, एक deep है, but we were not dealing much with it. Today we'll be diving deep into it, but we know these two muscles. From your thumbs up, I got it that you know these two muscles very well. You are clear about it. Very nice. And thank you for all the good emails which you have sent. Thank you so much. Achha. So here it is, flexor retinaculum, known to us, common flexor sheath, that is known to us, flexor digitorum superficial, flexor digitorum profundus, those two muscles are known to us. But that little finger, right, the fifth digit, this little finger, last one, right? It has got special entry. It has got special sheath, which is traveling all the way till the last point, and that is digiti minimi, right? Little finger. So see the little finger, fifth digit, it has got a special sheath for, and this fifth digit is called as the digiti minimi. So thus, now things are very clear. We have got flexor digitorum superficialis and flexor digitorum profundus, which are going through this common entry. And then there is a separate entry for the fifth, that is the digiti minimi. Right. All others for the rest of the fingers, second finger, third, fourth, right, digits, for them, things are normal, right? They will be going straight. And here is one more muscle, right? Because digitorum superficialis and digitorum profundus, they were taking care of fingers. For the thumb, we were having extra muscle, and this is flexor pollicis longus, right? Which we used to call very lovingly as flexor thumbalis longus, right? But exam ke liye, we'll be remembering it like flexor pollicis longus. So then there is flexor pollicis longus. Separate one, the separate entry. Here it is. So there is a sheath for that also, right? There is a sheath for flexor pollicis longus, flexor digitorum longus, and flexor digitorum profundus. But for flexor digitorum superficialis and profundus, but there is a separate entry for the fibers which will be going for the little finger. Clear? Okay. Remember, we are on the flexor side, right? We are on the flexor side. So whatever we watch, we'll be watching. Say this is flexor pollicis longus. Yes, flexor pollicis longus. And these will be going for the flexor digitorum superficialis and the profundus. So far, so good. But here is something which is going on this side, which is on the lateral side, right? On the lateral side. This is thumb. So this one would be the lateral side. We come across, say for thumbs up, right? Thumbs up. We have got extensor pollicis longus, because this is our palm, right? When we say flexion, extension, and then abduction and adduction, abduction, adduction, flexion, extension, everything rotated at 90 degrees for the thumb, right? Obviously, this is flexion, but here this is flexion, because thumb is rotated at 90 degrees. This is how it makes us different from monkeys, right? From Cro-Magnon, Neanderthal. So this is the difference, 90-degree rotation. Okay. This extensor pollicis longus, so it is just because it will be on the extensor side. But what is this space called as? This space is what?
Anatomical snuff box.
Anatomical snuff.
Snuff box, right? So do remember that this is the anatomical snuff box. It is present even in your hand. You won't be watching it here. It is so ulta na, yahan pe hai, right? So when you'll be watching this side, so yahan pe if there is flexor retinaculum, so then there is over here there is extensor retinaculum. So in extensor retinaculum, this anatomical snuff box, if you remember, bas khatam. You have learned the whole topic. Because everything, rest of the other things, they'll be in association with it. So ye to don't confuse yourself. Yahan pe just ऐसे लिख दिया है, right? Just for this is abductor pollicis longus, extensor pollicis brevis. So they too, and then there is extensor pollicis longus. That is how what they make this anatomical snuff box. But over here, from the flexor side, we can see these. We can see them. Right? Extensor pollicis brevis and abductor pollicis longus tendons, they are just seen. So that's why they have been mentioned. Otherwise, our focus is purely on the flexor component. Moving further, radius ulna, and over here, this is extensor carpi ulnaris. Right? This is posterior view. So extensor carpi ulnaris, and we'll see that extension over here. Right? That is for the extension of wrist. This part is clear. Now, whenever we talk about carpi, that means we are talking about wrist. Whenever we are talking about digitorum, so that means we are talking about fingers. Whenever we'll be talking about polysis, that means we'll be talking about thumb. Bas. So, right, whenever the muscles, their name comes carpi, that means whether flexor or extensor, they'll be moving for the wrist. We are dealing with the wrist. One simple thing. Whenever we'll be saying digitorum, digitorum means we are dealing with the fingers. And whenever we'll be telling polysis, that means we are dealing with the thumb.
Thumb.
Extra things which will come up is, one will be the indices. Indices means index finger. Upkeep this finger, right? Index finger. And digiti minimi, so we already talked about. That is the little finger, right? Digiti minimi. So this is extra which will be coming across. But so far, all good. So flexor retinaculum, yes, you can see that, right? And then there is a common flexion sheath. Common flexion sheath. And this is the sheath which is going for digiti minimi, and this is what is going for the polysis or the thumb. Right? If we go slightly above, so there is one what is called as the palmar carpal ligament. All the carpal bones, they are covered. Matlab wo chote patch mare, and then there is a big patch, right? Big patti. And that patti is palmar carpal ligament. Everything covered underneath it, right? And it gives strength. So it is like God has given this wristband, right? This is the wristband. So flexor retinaculum and the palmar carpal ligament. Not only that, if you have ever wondered, fingers हैं, यहाँ पे there is space. ये palm में space क्यों नहीं है? Because in palm also, if you really see, right? If you really see the bones, right? Only the bony structures. So then there are these metacarpals, right? तो बीच में तो space है, but then there are muscles. At the same time, we have got these ligaments, right? These ligaments. So there is one ligament which is connecting all the way over here, right, to knuckles. And that is what is called as the transverse metacarpal ligaments, right? These are transverse metacarpal ligament. One single row, and it is connecting everyone. So that's why your knuckles, they are that powerful. They don't break easily, right? They don't break easily because this is transverse metacarpal ligament. It is supporting through and through. So this is superficial. In case of PIP and DIP joints, right? In PIP, again, there is transverse retinacular ligament. I mean, those annular were there, right? Subse deep crisscross, there annular, and then on top of it, once again, there is a wrapping, right? So now you can imagine why it is so difficult to reconstruct the hand in surgery, right? When you do surgery, because surgical repair of hand is considered as complex due to these reasons.
सर आप वापस बोल सकते हैं क्यों? मेरे आवाज नहीं आया था.
Acha. What I was telling is, what I was telling was this, that we have got transverse retinacular ligaments, which are at PIP joint, over here, here. But underneath, there was already the annular ligament, right? Annular. And uske bhi andar, there was that crisscross cruciform ligament. So those sheaths, they actually give support. Right? They give support, and that's how the hand is constructed. So in surgery, more complex the structure, the more difficult the surgery would become. And see over here, we have not yet put muscles, right? This is just connective tissue. So the way we were having,
इसका मतलब मूवमेंट जितना, मतलब किसी बॉडी पार्ट का जितना मूवमेंट है उसके हिसाब से उसकी कॉम्प्लेक्स.
हाँ, जितनी एक्सिस पे काम करता है, ये कितनी एक्सिस पे, इट इज मल्टी एक्शियल सिस्टम ना. अपना हाथ जो है, दैट इज मल्टी एक्शियल सिस्टम. So that's why more number of joints, smaller joints, but at the same time support is to be given, because hand is something which is so tricky. In robotics, it is not easy to make anything near to our hand. The way we cannot create with the robotics, face cannot be created. Face can generate 90,000 expressions. 90,000 expressions. मतलब even if you say happy, तो अब आप सोचो, right now if I say कि happy face बनाओ, in 20 different styles, आप कहेंगे 20 क्या आया, मैं 200 बना दूं, है ना? Possible. And those things, they come automatically. So that's the reason it is very difficult to create face. And second, it is very difficult to create hand, because with hand, you can take a rose so delicately and you can give a hard punch with the same hand. It is simply because of this complex structure and multi-axial movements. So here is one more, which is like a filler. It is called as the palmar aponeurosis. Aponeurosis, you know, it is like a flattened.
Flattened.
Correct. So these are the transverse fibers. These are the transverse fibers which are just filling up the spaces, right? Okay. So these were in between, they were like transverse fibers. But then there are longitudinal fibers, the fibers which are in between. Even they are there. So they also give protection. So imagine the muscles, they are just enjoying inside, right? Upar to everything is very properly covered, right? And then these tunnels are created, and in these tunnels, all those ligaments, they will be working, right? And the tendons will be working. So we start with this. This would be a sort of revision. This will be a sort of revision. Say we talked about flexor component, right? Flexor component in the forearm. In the forearm, we said that 1, 2, 3, 4, 5. 5. How to remember those 5? That is with the help of this, right? Say if we are doing it for the right hand, so then we do it like this, right? 1, 2, 3, 4, and the 5th one. These are 5. And how you have to put your hand? You have to put your hand directing towards the ulnar side, right? You have to put it at the elbow, directing towards the ulnar side. So first one would be the pronator teres, right? Pronator teres. You remember there are 2 pronators. One is pronator teres, second is pronator quadratus. So 2 pronators, and then against that there is supinator. So there is only 1 supinator. So there is 1 supinator, single supinator, and apna plural, pronator teres and the pronator quadratus, right? Pronator teres is above, pronator quadratus is below. Okay. Then comes, because our finger is pointing towards radius, so flexor carpi radialis. So this was the first, flexor carpi radialis. After flexor carpi radialis, we have got the palmaris.
Variable one.
Variable,
Longer.
right? Palmaris longus is
Palmar is longer.
variable. Then we have got flexor carpi ulnaris, because it is going towards the ulna. So that is easy. And then you remove all of them, and then we have got big muscle, which is going, it is the flexor digitorum superficialis. Right? So these are the 5 superficial muscles. Similarly, if you remove all of them, so then you come across deep muscles. So flexor digitorum superficialis ka bada bhai, flexor digitorum profundus, right? Profundus, because it is a big muscle. That is the muscle which is sitting in the base. इसके सर पे बैठा था flexor digitorum superficialis. So this is flexor digitorum profundus. Profundus, that's agreed. But it is digitorum. Digitorum will say, I got nothing to do with the thumb. So that's why it will be going for 2, 3, 4, 5. As this also 2, 3, 4, 5. They'll say polysis, thumb apna kaam khud kar lega. So here is one more muscle. So this is done. This is one more muscle, which is flexor pollicis longus, right? Apna thambalis, right? So this is the flexor pollicis longus. We are into the flexor component, right? Those who have missed that lecture, for the sake of simplicity, we are talking about the forearm. In forearm, this is the flexor, this is the extensor. In flexor, there are 5 superficial and 3 deep muscles. We start from pronator, we end with pronator. Okay? And these are the muscles. These are the muscles which are superficial, and these are the muscles which are deep. Superficialis, नाम ही बोल रहा है कि flexor digitorum superficialis, but it is going for 2, 3, 4, 5. Flexor digitorum profundus just underneath 2, 3, 4, 5. What about thumb? This is flexor pollicis longus. Longus, that means they are starting from forearm and they will be traversing, passing, and
Extremes.
finally they will be reaching to the destination. बिल्कुल यहाँ tip तक जाएंगे ये these, right? So that's why they are long muscles. And finally, the pronator quadratus, which is over here, right at the wrist. So pronation, supination movements, I hope you know it very well. Supination is this and pronation is this. Right? So we have now covered these 8 muscles. The flexor component of forearm done. On to this is in general for किसी भी muscle का नाम. Carpals, whenever the carpal comes, that means they are wrist, right? Wrist flexors. So flexor carpi radialis, flexor carpi ulnaris, palmaris longus. वैसे palmaris longus का ध्यान रखना, because see palmaris longus आके, it will be landing just on the head of those sheets, right? आगे नहीं जा रहा. So obviously it will be acting only on the wrist, right? When it comes to digitorum, the flexor digitorum superficialis, flexor digitorum profundus, flexor pollicis longus. Finally, to digiti हुआ ना thumb. So that is, they are the finger flexors. Pronators, simple, pronator teres and pronator quadratus. So these are the major functions over. So that means that now out of this entire 4 things, right? We have got 4 things. This is the forearm, right? This is the forearm. In forearm, there is a flexor component. In flexor component, superficial and deep. You know that, right? Now, we have got the extensor, and similarly, we'll be dealing with the hand, right? So this much is done. Even if you missed previous lecture, this is done. Moving further. अच्छा, इसी के अंदर, this is for the nerve supply. This is for the nerve supply. Pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, they all are supplied by median nerve, right? Flexor carpi ulnaris थोड़ा टेढ़ा है कि ulnar, so then I'll be taking supply from my ulnar nerve, right? Done. Regarding the deeper muscle, flexor digitorum profundus, flexor pollicis longus, and the pronator quadratus, that is by anterior interosseous nerve. Right, anterior interosseous nerve, which is branch of median nerve. So far, all good. इतना आप वाइवा में बोलेंगे, that is more than enough, and it is wonderful. But for the flexor digitorum profundus, now visualize it. Flexor digitorum profundus. Right? Put your hand into anatomical position so that it will be flexor digitorum profundus is here. Right? This is the function of flexor digitorum profundus. Its function is to bend. Its function is to bend, even do this. Right? To do this. Just within next 5 to 7 minutes, you'll know that when it comes to flexor digitorum superficialis, I'll say its function is this. Its function is this. Function of flexor digitorum profundus is this. You got the difference between both of them? Flexor digitorum superficialis is this. Flexor digitorum profundus is this. This means your DIP, distal interphalangeal joint, is handled by flexor digitorum profundus. Right? Just itna dimag mein rakhna. The moment I'll put the figure, you'll know. So here it is. The ulnar half is by ulnar, that is ulnar nerve. अब तक बाकी का जो था वो median nerve. But in case of flexor digitorum profundus, right? In case of flexor digitorum profundus, so it is the ulnar half, right? That ulnar half, that is by the ulnar nerve, right? This much portion. On to the extensors. Now we are on the back side of the head. On the back side, there is one muscle. This is as such brachioradialis. Brachio is arm, radialis is radial side. So the muscle on your, this muscle, the muscle which you feel, right? It is a very powerful flexor. But because it is coming or going on that posterior side, so that's why we are just mentioning it. Otherwise, it is not an extensor. Brachioradialis, though it is situated posteriorly, but it is a flexor component. Okay? Here comes now our extensor gang. As usual, they will be going for the carpal, right? They'll be going for carpal. So there is extensor carpi radialis, because it is on radial side also, those extensors are going. On the ulnar side also extensors are going. But on the radial side, we have got two, extensor carpi radialis longus and brevis. So that means there are two muscles for that. And then this is for the wrist. The wrist done. What about the fingers? So extensor digitorum, right? Extensor digitorum. उंगलियों को सीधा करना हो तो एक्सटेंसर डिजिटोरम. रिस्ट को सीधा करने के लिए वी हैव गॉट एक्सटेंसर कार्पी रेडियालिस लॉन्गस एंड ब्रेविस, राइट? बट नॉट ओनली दैट, extensor carpi radialis longus and brevis from the radial side, and from the ulnar side there is extensor carpi ulnaris.
Ulnar.
Yera. So we have got extensor carpi radialis longus, brevis, and we have got extensor carpi ulnaris. Done. What about बाकी कौन रहा? Fingers. Fingers को सीधा करना है. Extensor digitorum. Extensor digitorum. ठीक. And then little finger said कि नहीं मेरी importance, right? ठीक है भाई, उसको भगवान का आशीर्वाद. तो extensor digiti minimi, एक extra छोटा मसल डाल दिया उसके नाम का भी. So this is extensor digiti minimi. So these are the basic muscles, right? These are the superficial muscles. What about the deep one? Deep one, right? For the deep ones, the easiest thing to remember, anatomical snuff box. Bar, right? We are repeating for this anatomical snuff box. So, when we do this, this is flexion. सीधा करने के लिए there is extensor. तो ये रहा extensor pollicis brevis and extensor pollicis longus. एक मसल ऊपर से आ रहा है, एक मसल अंदर ही है. This is brevis. Brevis means it is an intrinsic muscle, starting from hand and ending in hand. Longus starting in forearm, ending in hand, right? So this is extensor pollicis brevis. Brevis chota, right? And this is longus on the opposite side. And then there is mute, yeah. Aman. So abductor, right? Abductor, adductor, right? So this is abductor pollicis longus. So that is also there. This is nothing but anatomical snuff box. And then we have got the extensor indicis. On ulnar side, if digiti minimi is taking that advantage, so then index finger would say on the radial side, मुझे भी advantage मिलना चाहिए. So then extensor indicis is that. For the index finger, there is one extra muscle. It is extensor indicis. And the way it was, all those pronators were there. So this is a single supinator who is sufficient for doing the entire supinatory movement. Right? So this is these two pages. ज़्यादा कुछ नहीं तो ये दो पेज ना. Just cement it in your brain. लगे तो even लिख लेना 2 बार 3 बार 4 बार, right? And visualization would be more important. अभी भी repeat तो होंगे काफी बार. So carpi, same वापस वही की वही चीज. Carpi, carpals. So that means extensor की बात है तो wrist extensors. So we have got on the radial side, on the ulnar side, radial side, we have got the longus and the brevis, and the ulnar side बस एक ही है, the extensor carpi ulnaris. Wrist is done. On to the fingers. Fingers है तो नाम आएगा digitorum, digitorums, right? So we have got extensor digitorum. ठीक है. Extensor digiti minimi, वो छोटी उंगली. This is extensor indicis. इसने भी नखरे किए, right? Index finger ने. बस rest of the middle fingers, right? They are शरीफ के जो मिलता है चलेगा. पर बाकी indicis अपनी importance, digiti minimi अपनी importance और thumbalis तो it is already there, right? So for thumb, remember anatomical snuff box, right? Anatomical snuff box. So we have got the abductor pollicis longus, extensor pollicis brevis, and in between anatomical snuff box, and we have got the extensor pollicis longus. Done. These are the muscles which are important from the extensor compound side. Plus, there were 3 more muscles. One was brachioradialis, but brachioradialis is out of question. वो तो flexor है, वो तो बेचारा बैठा यहाँ पे है, right? Then the supinator. Yes, that supinator, that is there. And then there is one muscle, कोई इसको पूछता भी नहीं, right? बेचारा इसका नाम है एंकोनियस, right? Will invite एंकोनियस specially. But by the way, importance of Anconius is that whenever you do flexion, not flexion, pronation, supination, whenever you do pronation and supination, the function of Anconius is to stabilize the joint, right? So that's why it is that stabilization of elbow during pronation and supination. That is the sole function. That is the typical function of Anconius, right? Stability. It's so important. Okay. Here is. We are now into the hand. Right, into the hand. In hand, we understood that we'll be learning it into the 5 sections, 5 stages, right? One, which is bigger, thinner. Second portion, which is smaller, hypothinner. And then, so this was group 1, this was group 2, and then there was group 3, group 4, group 5. Group 3 was lumbricals, correct? Group 4 was dorsal interossei and palmar interossei and the dorsal interossei. Right. Interossei means between the bones till this point. So this is the number 4, number 5. Number 5, they will be between the bones. And these are the 3 lumbricals, which will be having super luxury to get their origin from flexor digitorum superficialis and flexor digitorum profundus. Right. That is how from those here it is. Right. So let me show you. So that is how they will be origin. But first, we start with thinner and hypothinner. For thinner and hypothinner, all you need to remember is all
All for one.
one. Bus. All for one. If you remember this much, Jabatas. Right. And how? These are thinner. Right. These are the thinner muscles. What will they do? Right. So if they contract, right? So they can do, say, if it contracts, so it can take thumb away. So abductor, it can lead to flexor and it can do this, right? So 3 movements are possible: abduction, flexion, and opponents, right? This is counting the fingers. It is called as the opponents. So we have got abductor, pollicis, brevis. Sab brevis hi honge. There cannot be longest because now these are thinner. These are the muscles of hand. Yahan se shuru hue, yahi khatam. So that's why abductor pollicis brevis, flexor pollicis brevis, and opponents pollicis. बस उसका आगे पीछे और कोई नहीं तो opponents pollicis, right? We have same way on the hypothinnar side. Hypothinnar means this side, right? Which is relatively smaller, which is for the lateral finger. तो everyone is called as DM, right? Digiti minimi. And then all for one. So abductor digiti minimi, flexor digiti minimi, and opponents digiti minimi. Done. 6 muscle or down, right? 6 muscles down. We are now having 2 important muscles which we must know. Ye 3 all for none, and then we said plus. When we say plus, plus means add. So this is the adductor pollicis, right? Adductor pollicis, because वो connected कहाँ पे है? It is like inside here. So when it contracts, so the thumb यहाँ पे था, तो thumb has to come back, right? Add. So this is the adductor pollicis, and for adductor pollicis, we'll just watch also, right? But just remember, it is having an oblique head and it has got a transverse head. Okay? So thus, on the thinner side, we have got all for one, right? Abductor, flexor, and opponents. And because this is thumb, so pollicis brevis, and pus, pollicis, right? For the opponents. But then there is 4th one, which is the adductor. So this is the adductor pollicis. Adductor pollicis, it has got 2 types of fibers. One is the oblique, second is the transverse. Finished. Let's come to thinner side. Thinner may be same katha. Abductor digiti minimi, flexor digiti minimi, and the opponents digiti minimi. But once again, the 4th one, that is the palmaris brevis, right? Remember Dubai, right? Palm Beach. So, याद रखने के लिए. So palmaris brevis. Done. So now we have finished 8 muscles. All these. This is the secret. Why there is claw hand. Why there is claw hand, right? When there is flexion at the distal interphalangeal joint, while there is extension at the proximal interphalangeal joint. So जो हाथ ऐसा बनता है, so here there is flexion and here there is extension, right? जो हाथ ऐसे, claw hand. We'll see next time when we'll be discussing the clinical part. But things are like this. जो अभी discuss किया, that in case if the movement of the flexor digitorum superficialis, so it is like this. But when it comes to flexor digitorum profundus, it is like this, right? It means we are talking about this joint, that is distal interphalangeal joint. Flexor digitorum profundus travels all the way and it lands on the distal phalanx. So on distal phalanx, flexor digitorum profundus it lands. They go via common flexor sheath, right? And then just somewhere in the middle of the proximal phalanx, this flexor digitorum profundus, it opens up the sheath and it travels further. Flexor digitorum superficialis, it lands on the intermediate phalanx. So this is the landing of flexor digitorum superficialis. This is the landing of flexor digitorum profundus. So that's how they are arranged. So in case if this joint is affected, with joint, distal interphalangeal joint, definitely something has gone wrong to FDP, flexor digitorum profundus, because it is the only one who will be reaching to that point. Just a better view, right? Flexor digitorum superficialis, their tendons, they will be landing at this point. Flexor digitorum profundus, it will be traveling and it will be leading to last digit. This is the FDP full view, right? All the way, flexor digitorum profundus, long muscle, big muscle, starting from forearm, travel kiya, and then going all the way till the tips. This is all other muscles, they have been removed, right? Superficial structures all completely removed so that we just see this flexor digitorum profundus. Here it was like made transparent, but here it is totally removed so that you see it properly. Now on to the flexor diagram. We are about to complete the topic. Yes, you have known almost everything. And now whatever the stuff which is there, you already know it. Right? Do you remember we were talking about those palmar arches, right? And we said that there are 2 arches. One is the deep arch and there is one what is called as the superficial arch. One is made by radial, second is by the ulnar artery. Which by which, right? And in order to remember this, we say like SU superficial. So that means superficial is made by
Ulnar.
and for the deep, we said that do write it like this. So deep arch is made by the radial artery. Now arch is like this. Who will be completing it? The branch from the other artery, right? So simply, when it looks so impressive, when we say that deep palmar arch, that is formed by the radial artery. However, it is completed by the branch from the ulnar artery. ठीक है ना? Because we have got radial on one side, ulnar on the other side, or kya? That's the only thing. And when it comes to superficial, the superficial is superficial and it is by the ulnar and it is completed by the branch of the radial. And from here, there goes all the branches, they are called as the digital arteries. So they straight away start traveling and that's how The whole thing is done. So you have completed almost everything. Let's see this. Flexor retinaculum. The question which is the favorite question of any of the Viva is what are the structures which are passing superficial and what are the structures which are passing deep, right? So here it is. We start with one by one, right? Structures which are superficial to flexor retinaculum. This is a small catch, right? यहाँ पे गलती होती है, बस तो थोड़ा सा ही ध्यान रखना है. कुछ याद नहीं रखना. Logic. Cutaneous branch. When they are heading for skin, तो why they should travel deep? ठीक है ना? If you are in Delhi and you are supposed to go to Mumbai, so then why to take a flight of Chennai? Right? So same way, जब skin को ही superficial देना है, that means cutaneous innervation. So first we are learning superficial structures which are superficial to flexor retinaculum. The first one is, this is flexor retinaculum, right? So palmar cutaneous, so this is flexor retinaculum, sorry. This is flexor retinaculum, right? That is the sheath. So palmar cutaneous branch of median nerve. Cutaneous, superficial, done. Next one. Palmar cutaneous branch of ulnar nerve. Again, right? It is ulnar nerve. So this is palmar cutaneous branch of here, the median nerve. And this one is the ulnar nerve because there are two major nerves, right? At this point, median nerve and the ulnar nerve. So their palmar cutaneous branches, they are superficial. Very nice. Right. The next one. So this is done. Their palmar cutaneous. So palmar cutaneous branch of ulnar nerve, that is there. And yeah, here it is. Now the structure which are superficial to this, right? This is the flexor retinaculum. Change the color. This is the flexor retinaculum. We are dealing with the superficial structure. So ये एक structure तो done, right? Then this was the second structure that is also done. Cutaneous branches. And then we have got a complete package. This is called as the ulnar package. It is called as the ulnar package. So in this ulnar package, we have got the ulnar artery, ulnar vein, and ulnar nerve. Sabhi ke sabhi. Right? So all of them, they will be passing superficial. So this is the ulnar package. So 5 things now we know. Right? Cutaneous, and the ulnar package. So this is 1, this is 2, and this is 3, 4, 5. 3, 4, and 5. Okay. Now this is the tendon of palmaris longus. Palmaris longus, what was the function of palmaris longus? Kya karta tha? What was it doing? Something which is not mentioned into its name, but it was doing what? Palmaris longus was doing what? What was the function? Kahan tha? Where was it located? In which compartment? Hello.
Flexor.
Flexor. So
Superficial.
it was flexion of
Wrist.
wrist. Exactly. Flexion of wrist, right? Because with all other components, all the carpals, flexor carpi, ulnar wrist, flexor carpi, this was the palmaris longus because it is attached over here. ऊपर ही attach हो गया. So that's why it is attached here. So that's why it will be giving flexion, right? So that's what I said, that इसके नाम में इसका function नहीं है, right? So that's why do remember, ये examiner लोग कई बार ऐसे question पूछते हैं, right? So this is palmaris longus, and it is attached to flexor retinaculum on top, right? उसके ऊपर ही. So that's superficial तो हुआ ना, right? Because this is the flexor retinaculum, वो आके यहाँ पे connect हुआ, so it is superficial. So this much is done. Now we go for the structure which are deep to flexor retinaculum, right? Structure which are deep to retinaculum. The first one, and the moment this question is asked, कोई दूसरी कथा मत करना, कोई दूसरी कथा नहीं. The moment this question is asked, first answer should always be median nerve. When you say that, you be asked the second question. अच्छा, which branch of the median nerve is superficial to flexor retinaculum? And then you can say it very confidently, and that is the cutaneous branch. Correct?
Palmar cutaneous.
Palmar cutaneous branch, because it has to supply to the skin, while rest of the nerve is supplying to muscles. So we need to protect it. That's why it is going underneath. Cutaneous, it has to supply up. So it is वो बाहर है. But median nerve miss मत करना. Right? Otherwise, what happens when you start speaking other structures, and if you miss this, तो ये exactly recipe में सब कुछ मस्त बढ़िया दाल बनाई, पर दाल डालना रह गया, बाकी सब पानी गरम किया, मसाले डाले, सब डाला, दाल रह गई. So this should not occur. Right? होता है. I said this thing even on YouTube also, सबको बोला था ये ध्यान रखना, फिर भी वाइवा में गलती करते हैं. Right? So do remember, I'm putting a star. Now rest is all ekdam easy. Ekdam easy. What is the function of flexor retinaculum? It prevents, बड़े अक्षर में लिखा था, it prevents bowing, right? मतलब वो सब टेंडन से बाहर ना आ जाए. हाँ, तो obviously now every tendon will be passing underneath only. So boldly बोलो, flexor digitorum superficialis. हाँ, उसके नीचे flexor digitorum profundus. हाँ, जाएंगे ही ना. Right? When superficialis is going, when superficialis is going underneath, तो बेचारा profundus बाहर कैसे जाएगा? मतलब जूते पहनने के ऊपर थोड़ा मोजे पहनेंगे. Right? So this is flexor digitorum superficialis, tendon of FDS. It will go. Right? Then flexor digitorum profundus, wow, right? क्या बात है, right? It will go. But वो ये याद रखें, remember this flexor digitorum minimi, right? That she is like a princess, right? She tells कि नहीं, मेरे लिए तो अलग से, right? This path. This is the flexor digiti minimi. Separate sheath for FDM. This can be a Trump question. वो डोनाल्ड ट्रम्प वाला नहीं है. Right? So this is the separate sheet for flexor digiti. There was one very must cartoon. You know, there is one character, Mickey Mouse, and this Pluto, and then there is Donald Duck. Donald Duck has applied into the court that I want to change my name. So now this is the common flexor sheath, right? Common flexor sheath, and through that sheath, our flexor digitorum superficialis, flexor digitorum profundus, and this flexor digiti minimi, right? Because there'll be a separate sheath for the digiti minimi. Flexor digitorum profundus, now we have already discussed, it goes all the way up to the distal phalanx. So, well, we know about it. And flexor digitorum superficialis, it lands on the intermediate phalanx. ठीक है. But thumb में तो intermediate phalanx है ही नहीं, तो flexor digitorum profundus, flexor digitorum superficialis will land where?
The flexor pollicis longa.
Ah, right? Flexor digitorum profundus, pollicis के लिए तो it is अपना thumb वाली थी. Good. So deep to flexor retinaculum, we have got the median now. सबसे पहला यही बोलना है. Then flexor digitorum profundus, flexor digitorum superficialis, right, with separate sheath for flexor digiti minimi, and we have got the flexor pollicis longus, right? क्योंकि ये क्यों बाकी रह जाए? So flexor pollicis longus. So they all are, remember, all of them सब ऊपर से आ रहे हैं, right? And that's why they have to be prevented from bowing, right? So they are given the protection. Moving further. Yeah, this is the doctor. This is the flexor pollicis longus, right? Now it comes to carpi. Remember, carpes will be landing on carpals. ठीक है? So flexor carpi radialis and flexor carpi ulnaris, they'll be inserted on कहाँ पे? Carpal bones. So
Yes.
carpal bones तो बिल्कुल अंदर है, they are deep. So then they are landing on carpal bones. उनकी छत के ऊपर that flexor retinaculum is there, right? So obviously they are underneath it. That umbrella to is up, right? Umbrella is up, flexor retinaculum. They will be landing on bones. So it is but obvious that flexor carpi radialis will be the next one who will be underneath, which will be deep to flexor retinaculum. So here is our list is increasing, right? We have got the median now. सबसे पहला flexor digitorum superficialis, flexor digitorum profundus, दोनों, right? Bye. And this is flexor pollicis longus, flexor carpi radialis. So far, any confusion? मतलब honestly हमने खूब रट्टा
No,
मारा,
sir.
right? हमने खूब
No,
रट्टा
sir.
मारा during our anatomy days, right? इतना रट्टा मारा दिमाग खराब हो गया, जो लोचे मारे वाइवा में फ्लेक्सर का एक्सटेंसर, एंड देन केम द ब्रह्म ज्ञान कि यार ऐसे नहीं होगा. हाँ, यू गाइस तो यू आर वेरी गुड. मतलब आई कैन मेक इट आउट फ्रॉम योर ईमेल्स एंड, अरे बाप रे, सो मेनी ईमेल्स. बाद में देखते हैं. बट यू गाइस आर वेरी सिंसियर. बट दिखाना ये व्हेन आई एम टेलिंग यू दैट यू गाइस आर सिंसियर, तो ये बाय द वे क्यों नंबर हैज रीच जस्ट 13. द न्यू नेम्स एडेड, they are like Soumya, Hiya, Placid Was, Gajendra More and Ajay Reddy. That's it. Total up tak 13 number. Only 13. Anyone wants to add for the Viva? Just let me know. This number is very less. बहुत छोटा number है. Please.
सर
Make an
वाइवा के लिए किधर है?
Viva कब है वो पूछ रहे हैं?
हाँ.
Tentatively Thursday. Next Thursday. आज Thursday है ना? Next Thursday. Because on Saturday we'll be going for the
कहाँ
clinical
पे
part.
रहेगा सर?
हाँ?
कहाँ पे रहेगा?
वाइवा कहाँ पे रहेगा? I'll be inviting you to my place. मेरे घर आना होगा आपको. यहीं पे. और कहाँ? But the thing is, say it will be 1-to-1. Say if I'm asking you, so then no one else is supposed to answer. Right? It will be 1-to-1. अभी के लिए ऐसा सोचा है कि I'll be asking 5 questions, but they can increase. If you are answering rapidly and confidently, तो I might go for few extra questions. ये जस्ट आपको ट्रेनिंग के लिए है. डोंट वरी मच अबाउट के एक दो क्वेश्चन गलत भी हो गए, कुछ लच्छे भी मारे तो चलता है. इट हैपेंस. नो वन इज गोइंग टू शूट यू, राइट? बट व्हेन यू विल बी स्पीकिंग इन फ्रंट ऑफ 100 पीपल ना, देखना कॉन्फिडेंस कितना बढ़ेगा. सो दैट्स व्हाई दिस इज लाइक अ होम पिच. इवन इफ 100 पीपल दे से ना कि नहीं हम वाइवा देंगे, तो आई डोंट माइंड. मैं 10 घंटे तक बैठा रहूंगा. आई कीप ऑन आस्किंग यू द क्वेश्चंस. बट लैक ऑफ दिस एक्सपोजर, ये आपको ना तब पता चलेगा व्हेन यू विल गो अब्रॉड. मतलब अपना अच्छा बोलने के लिए नहीं बोल रहा, पर देयर व्हेन यू विल फाइंड कि सिर्फ 5 सेशन में अपर लिम्ब खत्म और उसके बाद कहा कि चलो नाउ द प्रेजेंटेशन. अच्छा चलो ठीक है, वो तो बात की बात. बट डू सेंड मी अ मेल.
Hello, sir.
हाँ यस बोलो.
Yes, I'm Manthan here. How to enroll for that Viva and what
कुछ नहीं,
topics
जस्ट टेल
will
मी.
be?
मैं लिख लूँ ना मंथन.
Okay, sir.
नंबर
And what
40
topics?
अपर लिम्ब.
Okay.
Fine to I'm to
हाँ बोल दो, अभी बोलते जाओ. चलो आई एम राइटिंग. मंथन यस डन.
Sir, write mine also.
सर
माइन
सुफियान
मुझे नहीं
here.
पता, मुझे अपना नाम बोलो.
Anirudh.
अनिरुद्ध. ओके.
Sajida.
Just a minute.
सर सुफियान.
Sufyan. Yes.
Sajida.
Sajida, na? Sajida. Yes. Yes, Sajida. Ah, who won? Is it?
Tanvi.
Tanvi. Okay.
Ashraf.
Aman.
Ashraf? Ha, Ashraf. And now it is good.
Swara.
Swara? Am I right? Swara.
So what type of questions would be there?
Questions would be like, patient has come up with a hand injury, right? Hand has been split into two, and how will you repair it? Give all the surgical procedures, and how will you make a robotic hand? जो पढ़ा रहे हैं उसी में से पूछेंगे ना.
Sir, it will be on next
Preeta.
Tuesday, na?
हाँ क्या कह रहे हैं?
Viva will be conducted on next, not Tuesday.
Viva will not be on Tuesday because I got many emails that we need some preparation time. So that's why it has been shifted from Tuesday to Thursday. So that you get
Okay.
enough time, because once we'll complete all the clinical part on Saturday. So as such, if you see that पूरा Saturday, पूरा Sunday, Monday, Tuesday, Wednesday, इससे ज्यादा क्या चाहिए? 5 दिन. 5 दिन में तो आप 5 बार रिपीट कर लो, पूरे दिन बैठ जाओ ना. So it can be done even on Tuesday.
Sir,
हाँ बोलो ना.
so only general anatomy or upper limb?
नहीं, जनरल एंटोमी वैसे I was thinking of जनरल एंटोमी भी इंक्लूड करने का, but no, now I'm not including it. Just upper limb, pure upper limb.
Okay, sir.
Aman, should I write your name? That's why you're mentioned.
हाँ सर.
कर लो add. Okay,
Sir, add mine also, Preeta.
Preeta. Okay.
Sir, add mine also.
Tanvi.
Yeah.
But Tanvi, I have already added your name. Okay, or we have got 2 Tanvis.
Yes, sir.
2 Tanvis. Is there Tanvi 2 also?
Yes, then we do it.
Tanvi Gupta. So Tanvi Gupta is number 18.
So add my name.
Just a minute, dost. And Tanvi. And 24th number is mine. Mine कौन है?
Mine, Nisha Dalvi.
एक पता ही नहीं चला. Again, एक बात.
Nisha Dalvi.
Nisha.
Nisha Dalvi.
Nisha Dalvi. ठीक है, Nisha Dalvi. Nisha, your name is Placid Vaz. मैंने 2 बार लिख लिया. Placid, your name is on 11th number already there.
Okay, sir.
I'll just check it out in case if anyone is repeated. We have got now 24. Nitra, 25. Okay. Acha.
Sir, please add mine as well.
Mine कौन है?
Rizwana.
Rizwana. This is Samsung SM dash वही ना?
Okay. Yeah.
So how do I know here? I would write it like Samsung SMS911B. I would feel like I'm talking to a robot.
It's Rizwana.
Rizwana. Done.
Sir, please add Disha.
अच्छा, अब एक काम करते हैं. First, let's finish the topic. ठीक है? ये तो फिर रह जाएगा. And link would break. So here it is our layer 1, which is a thinner layer. Right? We talked about it, thinner and hypothinner, and we remember it like all for one. So this is abductor pollicis brevis, flexor pollicis brevis, and the opponent's pollicis. Just for the understanding that how they are located. Here it is, one muscle, and this is the second muscle, right? So this is abductor pollicis brevis. Logically, it has to be bahar ki side, na, laterally. Then and then it will abduct. Then and then it will abduct. So this is the abductor pollicis brevis, right? Thumb. Then the next one, which is over here, it is exactly on the top. So when it would contract, it would flex. So that's why this is flexor pollicis brevis. You remove both these muscles, under deep is the opponent's pollicis. So these 3 muscles done, which are on the thinner side. On the hypothinner side, right? And by the way, this is the superficial palmar arch, which is seen over here, right? Superficial palmar arch and superficial palmar arch, and it leads to formation of all those digital arteries, and those digital arteries, they will be reaching till the end, right? Till the end. This thing is very interesting when we'll be implementing the clinical part. What is called as the ain harm. Ain harm is when there is infection of the pulp. There are spaces over here. So when the infection, पता है कई बार उंगली में infection, तो it is so painful because it is divided into. This is our finger, right? This is the nail. This is the pulp. If this pulp is divided into several septas, right? And when these septas, if there is any infection over here, so then those septas, they are stretched. Over here, it has got the stretch receptor. So when they are stretched, it gives extreme pain. Extreme pain. And what is the solution? There is only one solution. You can't wait. You have to just put a small nick, right? Cut mara. The moment cut mara, it is drained, immediate relief. Immediate, because that stretching goes away. Now, same thing when we'll be learning the abdomen, we'll find that in our intestines, they have got only the stretch receptors, right? So if you stretch them, they will be giving extreme pain. But as such, if you cut them, there won't be any pain. That person won't be feeling any pain because there are no such receptors. The receptors are only sensitive to stretch. So that's why जब बहुत खाना खाया है, when there is gas in the abdomen, right? इतना pain, ah करते. So there is only two ways you can release it. One, take something which releases the gas. When the gas is released, right, so then the person feels comfortable. Or those muscles, right? Those muscles, they are not skeletal, they are smooth muscles, right? So you take cyclopam, which is like a smooth muscle relaxant. So when the muscles relax, so that means they give more space and person feels comfortable, right? These are the symptomatic relief. Symptomatic relief. They are not the actual relief. So for the actual relief, the thing what is called as the abdomen, which is called as the Pandora's box. Pandora matlab jadoo ka pitara, right? So there can be several things in that. So that's how it has to be diagnosed. But when we'll be discussing the clinical part next time, right? Such things will be discussed also. So digital arteries, we saw that. These are the lumbricals. For the lumbricals, there are unipinnate and the bipinnate. And it is the flexor digitorum profundus, right? When that is royally entering, right? And these are the 2, 3, 4. These are all from flexor digitorum profundus, right? They will be going for digit 2, 3, 4, 5, not the thumb. Thumb is 1. But this is the first, second, third, and fourth lumbrical, right? So this first and second lumbrical, they are unipinnate, right? Unipinnate, because they are emerging only from one side. Only from one side. This 3 and 4, they are bipinnate, right? They are bipinnate. So that's how they are. 1 and 2 unipinnate, 3 and 4 are bipinnate. But all of them, they are attached to all these tendons which are of flexor digitorum profundus. Okay. Till this point, palmaris longus, we talked about palmaris longus, which comes and lands over here and game over, right? Finished. But these are two extra things. One, this is the palmaris brevis. Palmaris brevis, right? Which was that fourth muscle, which we said that resort, right? Palm beach, and rest of the three were all for one, that is abductor digiti minimi, flexor digiti minimi, opponens digiti minimi, and this one was the fourth one. This one is the fourth one, correct? All for one and plus, and this one, we are talking about the hypothenar, correct? On this side, we talked about flexor pollicis brevis on the thinner side, right? On the thinner side, we talked about there was the other one was abductor pollicis brevis, if you want to fill in the blanks, right? All for one, and then there was opponens पोलाइसिस, आगे क्या?
Nothing.
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 Right? Smart हो गए. Right? Opponents polysis. And then there was one extra. वो कौन था? Fourth one.
Adductor polysis.
Adductor.
Ad-
Adductor.
Adductor polysis.
Full stop.
Nothing.
So it was that adductor polysis was having transverse head, right? And the oblique head. So that's the oblique head and the transverse head. All good. And this we already talked about, so I'm not repeating it. Right? Superficial palmar arch, we write SU, super, right? So that is ulnar. And for the deep palmar arch, we'll be writing
Radial.
yes, that is the deep palmar arch, completed by the branch of the opposite artery. So these are the common palmar digital arteries. They are arising from the arch, and then they go all the way till the end. They keep on dividing, and then they divide into medial and lateral component, and finally they meet, make the anastomosis just to make the entire circulation complete. Right, here it is. See, all the way. They divide, and then they keep on meeting in between also. Right? So that they make very proper. This is the reason कि जब यहाँ पे हाथ पे कोई इंजरी होती है तो then it bleeds so much because there are so many vessels which are supplying it. Hand, face and skull, right? They bleed very much. Skull के अंदर the bleeding का reason is different, right? Because skull is quite tight, so they don't let the bleeders close very easily. Then we have got the dorsal interossei. Interossei means between the bones. Dorsal and the palmar. So we remember it like dab and pad. These are the function. Palmar interossei, they are for adduction, and dorsal interossei, they are for abduction.
Abduction.
Right? And in hand, there is a difference. It is not like abduction and adduction, right? In hand, it is different. This is abduction and this is adduction.
Adduction.
ये ध्यान रखना. This long finger, right? That is considered as central axis, and
Terminal.
away from central axis, it is abduction. Near to the central axis, it is adduction. Right? Way back, जब शुरुआत किया था, when we were discussing all those movements, right? At that point, I said that someone said ना कि बस ये तो इतने छोटा सा, but now you know the importance कि that छोटा सा point, right? Why in hand this is considered as central axis and abduction and adduction. This is the reason. Interestingly, क्यों? Because here, if you see these interossei, right, they are connected on both the sides. So when both of them will contract, then this long finger will remain over here only. Other
Balance.
fingers they can go, but that because it is pulled from both the sides, so वो तो बीच में ही रहेगी, right? So that's why it is like this. What a wonderful mechanism, isn't it? हाँ, ये तो you know this now. Superficial palmar arch, deep palmar arch, radial, ulnar, all known. Comes the हाँ, ये भी आपको पता होगा, right? This is the thumb, which is rotated at 90 degrees. So flexion, extension, and abduction, adduction, right? So this is regarding the thumb. 90-degree rotation of axis. This is the advantage to humans because then you can grip it. Then because of this, you can really write it and you can do so many creative things. Now, this is a killer topic. Those who will be answering nicely will be asked questions from this topic. ठीक है? बाद में एग्जाम के बाद पता चला कि इतना बोला था तो इसमें से कुछ भी नहीं पूछा. Because I know you'll be preparing this thing so nicely. But that's why I'm writing it. This is the extensor retinaculum. No, seriously, abhi nahi problem hota. But when in the final exam of anatomy, if this question appears, na people sweat. क्या question पूछा? Now this is the extensor retinaculum, right? On the back side. It is divided into 6 chambers. Yes, when you'll do dissection, you'll find that there are septas in between. So you have to draw it along with me. Right? So first thing first, so write 1, 2, 3, 4, 5, 6, 6 chambers. And it is important we are starting from lateral side. We are starting from lateral side. Right? Lateral side means we are starting from radial side.
Radial.
Right? याद इस तरह से रखो कि even the अपना carpals, right? वहां पे भी 1, 2, 3, 4 we were starting from the lateral side. ठीक? First 3 chambers, 1, 2, 3. That is anatomical snuff box. So the moment is the anatomical snuff box, the lateral most would be the abductor. The moment पहला word आ गया abductor pollicis longus, done, जीत गए, right? Because abductor pollicis longus, then एक longus आ गया, तो then in that extensor pollicis brevis, and सीधा jump मार के third में जा जाओ, extensor pollicis longus. So in between, this is your anatomical snuff box. Now, if you remember, there was one question which was asked, that this is extensor pollicis longus, this is abductor pollicis longus, and this is extensor pollicis brevis. So then there were two tendons. They were passing बीच में से pass हो रहे थे. They are extensor carpi radialis longus and extensor carpi radialis brevis.
Brevis.
Right? That wonderful. So this is our chamber 1, this is chamber 2, and this one is chamber 3. If you have understood this, bus, right? This is the considered as most complex part. बाकी अब कुछ नहीं, अब एकदम easy. So this is done. And this is on what side? Radial side. Radial side means thumb side. Thumbs means apna thumbalis, right? Pollicis. So pollicis part is complete. Extensor carpi radialis longus and extensor carpi radialis brevis, they were for the wrist extension. So this is for the wrist, right? Otherwise, thumb part, that is done. Now, digitorum. Digitorum, obviously, up to we are into 4th chamber. Up 4th chamber mein, so we need to talk about the digits. So digits extension, right? So extensor digitorum. But when extensor indicis, right? This first finger, right? First finger has got its own importance. So extensor digitorum and extensor indicis. But basically, we are talking about digits, right? But this is special, right? Indices भूल जाते हैं, तो ये याद रखना. And then we have got anterior interosseous artery and posterior interosseous nerve, right? Anterior interosseous aya and pin, right? Anterior interosseous artery and posterior interosseous nerve. So this 4th chamber is done. Finally, पहुंच गए 5th chamber. When we have finished the digits, so the last princess, right? Extensor digiti minimi, right? So then we keep that extensor digiti minimi. And then extensor carpi ulnaris, वो तो वैसे भी it is only for the wrist. वो तो यहाँ आके खत्म हो जाने वाला है. It will not be going further because its function is extension of the wrist. So this is extensor carpi ulnaris. These are the 6 chambers, and समझ भी आ गया हो तो भी keep writing. 2 बार रिवाइज करना, 3 बार रिवाइज करना, before you sleep, go to sleep, just go through all these things, right? Conceptually, make yourself very strong. Oh, more than 15 messages. I'll see to that. Just wait. Let's finish it, right? So this is flexor retinaculum, in which we were having superficial structures and the deep structures. And in extensor retinaculum, everything is divided into 6 chambers. In nutshell, this is what you are supposed to know, right? So here it is. This is the extensor retinaculum. Now let's watch every chamber individually, right? For the clarity. So this is the extensor retinaculum. Here comes chamber 1, C1, chamber 1, right? See the chamber 1. This chamber, which is going here, right? Which is here. This is the first chamber. And in that first chamber, so good, right? Abductor pollicis longus, it has to be the lateral most. Done. Extensor pollicis brevis, yes, done. So this is the chamber 1, complete. Chamber 2, which will be in between, right? Chamber 2 is in between to extensor carpi radialis longus and extensor carpi radialis.
Extensor
Brevis.
carpi
These are the
radialis
green
brevis.
things, right? So they are sitting in between. So who will be this third one? ये कौन सा है?
Extensor pollicis
Extensor
longus.
pollicis longus. Extensor pollicis longus.
Pollicis longus.
Shabash, shabash. Very good, very good. Right, extensor pollicis longus. Then
Extensor index
Extensor
Extensor
index
index.
and
indice.
extensor
Extensor
and extensor digitorum.
Shabash. Extensor indices, देखा सीधा, just for one. Right. And the extensor expansion of extensor digitorum. So this is what is called as the extensor expansion. So it expands and then once again it joins further. Right? That's how it really goes. And the extensor digitorum said that this is chamber 4. So in chamber 4, we were having extensor indices, extensor digitorum, and IIN pin, anterior interosseous artery and posterior interosseous nerve. Chamber 5, extensor digiti minimi. Correct. And chamber 6, extensor carpi. And it will end here, bas, because its function is to extend the wrist. Kuch nahi, zyada kuch nahi. And here comes our Bichara enconius. The function of enconius is
stabilize the elbow.
Stabilize the
during pronation and supination, and done. Finished.
Thank you.
So now you can have Afra Jalebi in case if you are. So take care and see you on Saturday. Saturday will be, I'm thinking that we'll revise everything. The entire upper limb. So those who might have missed any of the lecture in between, along with the clinical, will revise the upper limb, pura upper limb, so that there should not be any excuse. Meantime, there are kitne naam hai? 26 names are there. किसी को भी add करना हो, तो just send a mail to me. I'll add that. ठीक है? Thank you so much. Happy Dashera and take care.
Thank you, sir.
Sir,
Thank you, sir.
sir, where is
Someone-
palmar carpal ligament situated?
Which one?
Palmar carpal ligament.
Palmar carpal
Thank you,
ligament.
sir.
Thank you. Thank you. On the carpals. On the carpals. Right. So, right. So these are the carpals. All these palmar carpal ligaments, right? You'll find them over here. It is this region.
Sir, then flexor retinaculum is ahead of it.
Yes, yes. Flexor retinaculum is pretty superficial. It is superficial because see, these are all palmar carpals. They will be connecting all those carpals along with the fascia.
Okay, sir. Thank you. Thank you, sir.
So see you on Saturday. Saturday.
So,
Just very fast.
so
Very
I
fast.
will online or offline?
Viva? Viva will be online or offline? That's what you are asking?
Yes, sir.
It would be, obviously, it would be online. Otherwise, you have to fly all the way to Ahmedabad. It is to be.
Yeah, that's what I was also
अच्छा, ticket
confused.
book करने के लिए हाँ तो then you can book the tickets. अच्छा, आरती, that my name.
Excuse me, sir.
हाँ बोलो बोलो.
Sir, this is my first class. Because of some reason, I wasn't able to attend the previous classes. So what should I do?
बस एक काम करो. Send a mail to me. You have got the email address? कि नहीं? वो भी नहीं होगा शायद. Email address is tillurmbs@gmail.com. Because if this is your first class, what would happen is that just within next 1 or 2 sessions, this upper limb will be totally completed. And then we are planning to start physiology and parallelly the lower limb. And in lower limb, 3 lectures will be taken together. Right? So we'll be going very fast. So I'll explain you the entire procedure, what you should really do. What's your name? Who is it? Realme 6i?
Yes, sir, Usman. It's Usman.
Listen, naam. Acha. So send a mail to me, right? I'll explain everything properly.
Okay, sir.
सर मेरा भी फर्स्ट क्लास ही है मैं भी मेल सेंड
Saturday, is it
Thank you,
clinical lecture or revision? Japna, it will be combination, both the things, right? So while taking apna this clinical part, we'll be going for the revision also.
Okay,
Yes,
sir.
happy Dashara, happy
सर
Dashara. हाँ
सर जैसे आप रिवीजन ले रहे हो ना सैटरडे को
हाँ
कैन यू गिव अस माइंड मैप ऑफ द आर्टरी एंड द वेन स्टार्टिंग फ्रॉम द C1 C2 till in the hands
हाँ
lung
बीच में
radiator
हाँ as such ना वो if you really check out the notes उसमें है भी सही, but still we'll do that.
हाँ सर उसमें है बट क्या वो अपर लिम्स के पूरे पीडीएफ को जैसे मेरे को ह्यूमरस देखना है ना तो फिर आई हैव टू ओपन 2-3 पीडीएफ्स एंड 2-3 क्लासेस तो ऐसा अगर एक माइंड मैप रहेगा ओनली
हो
फॉर
जाएगा
फॉर नर्व एंड ऑल
no problem. Hansika, I have added your name. And who else? Ulshri. Yes, I'm adding your name also. Ulshri. And who else?
Sir, I have a question.
This is my first time. Acha, who said someone?
It's me, Rizwana. So if someone does not have an access to PDF or the notes, where we can find that?
Just send a mail to me. I'll send you the link of the Google Drive. There is a Google Drive in which all the
Okay.
PDFs, right? Whatever the things which we have discussed right from the day one, everything is landing over there. Plus, I'll be giving, plus there is YouTube channel of under my name only. So there, all these lectures, they are there. Every lecture is there, right? The only thing is this is like live, but that was also live taken for other batch, but at least you'll be getting the clue, right? So if you just look at that PDF and listen to that lecture, that would be enough.
Cool. Thank you.
Thank you. And sir, on Tuesday, will it be lower limb? नहीं. Lower limb तो कैसे लेंगे? तो फिर अत्याचार हो जाएगा. उस दिन नहीं, बाद में.
Yes, sir, because it is still pending
हाँ.
from my side.
Yes, you can come for Viva offline. मुझे यार तुझे फाफड़ा जलेबी खिलाना पड़ेगा.
Thank you, sir.
नहीं, we'll plan to meet. मतलब I am getting few emails. करते हैं कुछ.
तो एक्चुअली आई हैव अ डाउट विद दिस एक्सिला ये पेक्टोरल मेजर के नीचे है कि पेक्टोरल माइनर के
क्या
एक्सिला
चीज?
एक्सिला
Axilla is like a virtual space. Is like a space. It is like a potential space, right? So pectoralis major, it is making the wall. It is making the wall.
Lateral.
Huh. Right. So then when it is making the wall, so the space which is in between, it is called as the axilla. जबकि pectoralis minor जो है, pectoralis minor तो वो it comes in the front, ना? It comes quite in the front and it is a छोटा muscle. Acha, so I'm getting few messages. Let's be clear. Send a mail on this one so that I can give you the link of that Google Drive. In that Google Drive, there are all the PDFs which we have discussed till this date. Journal anatomy and apna this upper limb also. And it is this link which will remain active till we are together. Right. So all our further sessions, they will be, I'll keep on creating new folders. So for example, there is a new folder on upper limb, right? So it is there. Second, you can go to my YouTube channel, right? And same name, right? And over there, don't go haphazardly, go to the playlist. In that playlist, there is one playlist which is of journal anatomy, right? Go through all the lectures. Then there is lecture on upper limb, mastering anatomy, upper limb. Go through all the lectures. Right? So you'll get a complete idea. Huh. this much cannot be completed. I saw that. This much cannot be completed till Tuesday. Surely not. So those who have joined recently, right, and who have missed many of the lectures, at least attend. And on that day, extempore, if you feel like, okay, you have completed or you have studied only first 5 lectures. Okay? So I'll ask you questions from that much, right? Decide on that day. But yes, I would really like more and more people should really appear. It'll give you tremendous confidence. Dekhna. On that day, you'll feel so good. Right. Yes, Usman Ghani. This today was. Okay, I'll just reply to you. Right? I'll just reply to you. But otherwise, say I have to send you the link for this Google trial, and on YouTube, so you can search it. Or it is very simple. Even if you do just this much, YouTube /@ and then you no space in between, right? Continues Dr. Bankim Jani. When you write, you'll automatically reach to that link, right? It is simple. Okay, so thanks a lot and see you soon.
Thank you, sir.
Thank
Thank you.
Thank you, sir.
Sir.
Thank you, sir. Thank you, sir.
Bye.